Hello everyone, welcome to today's video. Today we will cover risk treatment in our topic next in our discussion of ISO 27001. So when it comes to managing risks, there are four primary options for treating them, and each approach depend on the nature of the risk and the organization tolerance for it. And this is an continuous exercise from the previous one, which was risk assessment. So in risk assessment we have identified and we have given priority to each of our risks, that what are our risks, how critical they are. Now how to treat and deal with them, that we will discuss in this risk treatment topic. So the first one is control implementation. This is the most common approach where security controls are applied to reduce the risks. These controls can be selected from various frameworks such as the ones mentioned in the annexures. And the annexures, we had a very detailed number of videos that what are the annexures are, what are the security control it suggests to implement. The goal is to mitigate the impact of a risk by putting security measures in the place, thereby lowering its likelihood or severity. The second one is risk transfer. In this case, the risk is transferred to another party. A common example of this is using insurance. By purchasing an insurance policy or establishing service agreements, the financial burden in case of a disaster or breach is shifted to a third party, ensuring that the organization isn't solely responsible for the fallout, or the loss is not completely beared by the organization. The third one is risk avoidance. This approach is about eliminating the risk entirely. If a particular service or activity creates unacceptable risk, the best option may be to stop or avoid that service altogether. By choosing not to engage in activity that poses a risk significantly, the organization effectively avoids the potential for harm. And the final one is risk acceptance. In some cases, the cost of mitigating a risk might be higher than the actual impact of the risk itself if it occurs. In these situations, organization may choose to accept the risk, acknowledging that while it exists, it's not worth the resource required to eliminate or reduce it. Each of these risk treatment options requires a careful assessment to determine the most appropriate course of action based on the potential impact, available resources, and the risk appetite of the organization. So these were the four methods that how a risk treatment can happen. Each of any of these method has to be chosen depending on organization capability, risk appetite, and the factors we have discussed. Thank you so much for watching this video.